Hi everyone, this is Dr. Zach Borus from Dickinson County Public Health and Lakes Regional Healthcare and Avera Spirit Lake Medical Center here in Spirit Lake, Iowa. It's the 20th of March, and I just wanted to give another update on the coronavirus, where we stand here in our local community and as a national crisis, as well as sort of talk about what we're doing here to prepare and what has changed since I last came to you on Facebook, and also to talk about what you can do to protect yourself and the community and sort of where we are in this. So first off, things have changed a lot this week. As you know, restaurants, exercise locations, pools, community centers, etc. are closed, other than takeout from restaurants. And I would encourage you to continue to support your local businesses either by getting takeout or getting gift cards from them, because really a lot of folks are dependent on those jobs and that work to keep themselves and their families going. So take care of each other and take care of our community. But things have changed. Kids are now a week into homeschooling, which is interesting, and I hope that that's going okay for you. Remember to give yourself some grace and know that this is okay. This is an interesting time. In Iowa, there are now 44 cases as of last night confirmed. There are 15,000 plus cases in the U.S. that are confirmed, and there have been more than 200 deaths in the U.S. from coronavirus. We're really starting to see a lot more reported cases, or confirmed cases that is, in part due to increased testing. Big change in Iowa in the last week, which led to a lot of these public health and government changes, is that there is confirmed community spread in Iowa. So people are getting the disease from their neighbors or from their family members, or potentially even from just being out in the community, and not just from travel to hotspots. So it's here, and while it seems very disruptive, I'm relieved that the governor has made these changes to help slow down the spread. I think that everybody is doing a great job of generally staying home unless they have to be out. So thank you for that. Remember that we're all trying to take care of ourselves and our community and try to slow this spread so that it doesn't become overwhelming. Here in Dickinson County, as of today, we do not have any confirmed cases yet. Despite what you might hear on social media, we have been testing, but we have not had any positive cases. So that's good. That said, there may be some here that we just don't know about, based on fairly still rigid testing criteria. So here at Lakes Regional Healthcare, we have been changing our setup drastically and quickly to help address this. So if you think that you have fever, cough, or potential exposure, we want you to call our hotline, which we have just gotten running officially today. It is 712-336-6696, and I'm sure you'll see other posts referring to that. But again, 712-336-6696. That's staffed from 8 a.m. to 5 p.m. currently. You can also call the ER after hours, or potentially call that number as we get it more staffed in later hours. We will keep you posted. Visitor restrictions have been put in place here at the hospital, so all patients may have one visitor per day, and that doesn't apply to folks who are in hospice care in the hospital or end-of-life care. They may have two at a time. However, everyone who's coming into the hospital needs to be screened. So you need to use one of three doors, either the east entrance in the new wing, the door B right outside of Lakes Family Practice, or the ER entrance. And those are staffed while they are open. And people are taking your names, asking about symptoms, putting a mask on you if you have symptoms, potentially asking you to wait out in your car until you can be called by the triage nurses at the hotline, which will give you more information. So we know, and they are also taking temperatures at the door. So if you have a fever, again, you will be asked to wait out in your car. This is to protect each other. So please be patient with us. We know it's a little disruptive. This is all disruptive. So we appreciate your working with us to make sure that everyone is safe. If you call the hotline and they want you to come in to be evaluated, if they have high suspicion that you might qualify for a test, then they will likely have you drive up into the ambulance bay and stay in your car, where a nurse and or a nurse practitioner will see you, potentially swab you for influenza and RSV and strep to make sure that some of the other still quite common illnesses are not there first, and then if they still feel that you meet testing criteria for COVID-19, they will do so. As I'm sure you've heard on TV, there's limited testing supplies, but really the big picture is that for many people this is a mild illness, and we encourage you that if you are feeling ill, don't panic, don't feel that you need to be tested immediately, but follow the guidelines of stay home, wash your hands a lot, try to limit contact even with family members while you are ill, and then if you are feeling short of breath, if you are having more trouble breathing, if you are having high fevers that are unrelenting, if you're just really, really sick, then that would be a time to be evaluated. But again, please call before you come. Most of us are, if we get this, are going to be able to ride it out at home and are not going to need hospitalization, thankfully. But as I talked about on Monday, folks who are immunocompromised, people with certain chronic illnesses, people who are older, have the potential to get very ill from this. And as more and more cases are being diagnosed on the West Coast and on the East Coast, we're finding that a lot of younger people are needing hospitalization and ICU care. They don't tend to die from it necessarily. However, this is a real issue. So this is not a conspiracy. This is not fake news. This is real. And I think that the response that we're seeing from the government is appropriate. So please trust that we are doing our best to take care of our local community, and that while seemingly intense, some of these limitations really are necessary. So we are trying to slow the spread of it so that we don't have a spike in severely ill people all at once, so that our hospitals, when it does get here or when it does get to other communities, so that our hospitals are able to take care of those people without overwhelming the resources and having to make really tough choices. So make sure that you're taking care of yourselves. Make sure that you are getting outside if possible. I know today it's snowy after it was 60 degrees 2 days ago, so welcome to Iowa in the spring. But if you can exercise at home, do so. If you can get outside and take a walk or take a jog or get on your bike, do so. I still encourage folks to avoid social gatherings. The official guidance from the CDC is no more than 10 people in a gathering at once. I would encourage you to even limit that further, to try to avoid play dates unless you have to have childcare. Try to, as much as it stinks, try to avoid playgrounds with your kids. We're trying to slow the spread, and kids can be asymptomatic carriers of this who then could take it home and then could get their parents, grandparents, others really sick. So this is hard for all of us. As a parent, this is hard. I know this is a scary time as well. We want to give you reassurance that we're doing all we can to prepare here so that if and when it does get here in full force, we are able to really manage the crisis. We have an excellent medical staff here and excellent resources, and we will weather this storm, but this could be uncomfortable for a while. So bear with us. We will keep you updated as things progress and as things change. As you know, things are changing every day. Our testing guidelines are changing every day. The availability of supplies is changing every day, but we are doing our best to stay on top of this. Make sure you're taking care of yourselves. Take time to breathe. If you're not an exerciser, do some meditation. Do something for yourself each day. I know this can be overwhelming, but really make sure that your mental health as well as your physical health are being addressed, and that your kids are as well. And keep working with us to move forward, and we'll keep you posted as we go forward. So thank you for your time. I appreciate it, and appreciate all that you're doing in this uncomfortable time to stay at home. Don't go out if you're sick, certainly, and try not to really, we'll get through this, and it's going to be okay. Thank you.